Hi everyone. In this lecture, I'm going to discuss vitamin D. Vitamin D is one of the fat-soluble vitamin that is, it can be soluble only in fat or in organic compounds such as chloroform, ether, and benzene. It is a hormone-like vitamin. Among all the vitamins, vitamin D is the hormone-like vitamin, and it is especially act as a precursor for the synthesis of many hormones and other lipid containing compounds. uh, Precursor in the sense from vitamin D, many hormones and other enzymes can be synthesized. And what will happen if we did not take vitamin D in right quantities? It may lead to rickets and osteomalacia. Ricket will happen in children that is below 10 to 12 years. The child may experience ricket if they are having vitamin D deficiency. Rickets are nothing but bone demineralization disorder, where the calcium and phosphorus level in one's bone will be very less, and the children may born with bone deformities and they have pliable bones. It can be easily fractured. And the other disorder that may happen because of deficiency of vitamin D is osteomalacia. And this is a condition it will have that will happen in adults who are over 40 years of age, and they were healthy. Initially, they were born healthy adults, but when time goes, because of their insufficient intake of vitamin D foods or insufficient sun exposure, they may give rise to this kind of bone disorders. So their bone will lack uh, the innate calcium and phosphorus levels, and they will become soft and uh, may lead to fracture. So these are the two major disorders that will happen because of the deficiency of vitamin D. And what are the major sources of vitamin D? How we can prevent this vitamin D deficiency disorders is by undergoing sun exposure. Yes, it is actually an unusual source because we have some precursors present in our body. Only when upon exposure to sun, it can be converted into its active form. For example, in animals and humans, we all have vitamin D in our skin in the form of 7-dehydrocholesterol. And upon UV radiation or upon sunlight, it will be converted into its active form, that is vitamin D3, otherwise called as calcitriol. And also in plants, plants also will be having vitamin D2 in its inactive form, that is called ergosterol. And upon UV radiation or upon sun exposure, that vitamin inactive vitamin D is converted into its active form, that is ergocalciferol. Okay. So that is why we have sources both in the form of sunlight, and also we have some foods to increase uh, uh, our bone strength and teeth, because they all have vitamin D. They are mainly meat and meat products such as salmon, fish, and then cod liver oil, eggs, and milk products. They are all the major sources of vitamin D. And the biochemical functions of vitamin D. What will happen if we have vitamin D uh, in sufficient quantity? Actually, we have some active forms of vitamin D, right? That is calcitriol. This calcitriol helps in the reabsorption of calcium and phosphorus that is necessary for our bone from the food. Usually, after metabolism, half of the minerals will be excreted in our excretory system. It will be excreted in urine. Usually, minerals like calcium and phosphorus will be excreted in urine. So, in presence of vitamin D, what will happen is this minerals that are excreted in our urine will be reabsorbed back into our body, and it will help them to deposit in our bones and teeth. So this is one of the important biochemical function of vitamin D. But it may also lead to some threats because vitamin D if we take vitamin D in higher amount, larger quantities, it may lead to some lethal effects, some toxic effects. Because as I said earlier, this vitamin helps in the reabsorption of calcium and phosphorus, right? So what will happen is in our kidney, it will start forming some stones. So this condition is called a hypervitaminosis. So if we intake vitamin D in larger quantities, it may also lead to some lethal effects. So we have to take everything in a perfect right amount to prevent the diseases. And the coenzyme forms of vitamin D is, of course, it is calcitriol, and it helps in the mineralization of bones. Thank you.